back to our channel. Dr. Kehinde Elisha speaking here. We are here to introduce the Certified Expert Review. That is called the CER. What exactly is it all about? So, we have designed a course for psychiatric nurse practitioners that passed their boards already and physician's assistants that passed their boards, and they're looking for something to get some knowledge in before they actually start their first job, or while they are waiting to keep that, fire going, to keep that fire burning so they don't forget everything they learned in our review. So we usually go through one drug for 30 minutes. It's that serious. We're going to give you a little glimpse of what we talk about during our sessions. We have some more sessions starting up in May, so we look forward to having you join us. This course is designed by Dr. Kehinde Elisha under Kehinde Elisha's Learning Institute, Kelly, Keli. To email us, nursetonursecoach@gmail.com. Most of my resources come from Stahls' Psychopharmacology book. Very standard, very solid. My sample video today is going to be mood stabilizers. So when we talk about mood stabilizers, I'm going to pick valproate. So what is the objective? To talk about the brand of the drugs, if it doesn't work, how to augment. If your patient experiences side effects, what do you do? Those are the questions that are faced by our new nurse practitioners and physician assistants. So we try to, keep things smooth, easy going for them. We design this course like a school. We help you, guide you, give you like everything or most things you would need on your first day or your first week of a new job. And then you'll be able to make an informed decision without, being so worried and scared. You know how we all are with our first jobs. So let's get started. So the valproate, what lab value do you want to get? So before you put the patient on the medication, you want to check, do you need any kind of blood level? Do you need any kind of lab? You have to know that. You don't want to prescribe a drug and forget to get a lab and not have a baseline. That is a no-no. So before starting treatment, complete blood count, check coagulation test, check liver function test. These are all crucial before starting your valproate. So valproate comes in so many brands. Some of them, Depakin, Depacone, Depakote, Depakote ER, Stahls. Stahls is not commonly mentioned in the United States, but just be familiar with that. So what do we use Depakote for? It is commonly prescribed for complex partial seizures. For simple complex absence seizures, can be used as a monotherapy or adjunctive. It is used for multiple seizure types, which includes absence seizures as an adjunctive therapy. It is used for migraine prophylaxis, like valproate or valproate ER, or valproic acid delayed release. These are the uses. And we use, of course, for our mood stabilizer. Definitely, that is the one that affects us directly. Valproic acid is used in acute mania, episodes or mixed episodes. Of course, the brands that we typically use, valproate or valproate ER. Take note of that. So what if you prescribe this drug to your patient? If it doesn't work, what do you do then? Of course, you want to consider checking the plasma drug level first, just to give you just to let you know whether you need to increase the dose or not. You might want to consider switching to another agent or adding an appropriate augmenting agent. So you can also switch to another mood stabilizer with fewer side effects. Consider evaluation for another diagnosis. Sometimes we are wrong. Sometimes we don't know, or we didn't describe, the patient is not well, diagnosed. So if that is the case, we might be treating the wrong thing. Let's not forget our assessment, diagnosis, intervention, and all that, they will still go with us for the rest of our lives. The nursing process, our ADPI. So if our assessment is wrong, our diagnosis will automatically be wrong. So let's keep that in mind. So now, if the drug is not working, what do you want to do? You want to do something that we call augment. You want to go ahead and augment if it doesn't work. So what can you augment valproate with? You can augment with lithium. You can augment with atypical antipsychotic. So look, When you are augmenting with antipsychotics atypical, what can you choose from? You can choose from risperidone, olanzapine, quetiapine, zoprizidone, aripiprazole. Lamotrigine, though, you can also augment valproate with lamotrigine, but with lamotrigine there is a little clause to that one. Okay, so you got to be very, very careful because valproate will more than double lamotrigine level. Therefore, you have to halve the dose. Okay, you have to halve the dose because valproate will raise the level of lamotrigine up. And don't forget, lamotrigine in a general population can cause Stevens-Johnson's rash also, among other side effects. So let's now say we have side effects. What do you want to do? Don't forget, we first of all address if the drug doesn't work, what do? We're going to augment. Now, if we have side effects, we're going to now look into what we're going to do next. So first you want to wait. Sometimes many drugs will give you a very rough start and then slowly kind of like wind down, So then, depending on what side effects they are having, after you wait and they are still experiencing it, let me say they're experiencing sedation, you would tell them to wait and take it at night. That way they can sleep all together, right? Now, if it's other kind of side effects that we just can't explain it away, we want to drop the dose first. We don't want to just stop right there. We want to stop it, slow it down a little bit. So lower the dose. If that still doesn't work, you want to go ahead and switch to another agent. So what can you augment valproate with? Now we are augmenting the side effects. Don't forget, there are different augmenting agents for when the drug is not working. We also have different drugs to augment when we are experiencing side effects. For example, propranolol, 20 to 30 milligram 2 to 3 times a day may help reduce tremor. Multivitamins fortified with zinc and selenium may help reduce alopecia. Many side effects cannot be improved with augmenting all the time, but it's still worth trying. So let's say we tried everything and nothing worked. What are we going to do? You're going to have to stop the drug, right? So how do you stop valproate? You want to taper it. So you may need to adjust the dose of current medication as valproate is being discontinued, but you need to taper it slowly. Don't stop abruptly. Patient may cease upon withdrawal too, especially if withdrawal is abrupt. When we discontinue too rapidly, it can increase the risk of relapse in bipolar disorder. So discontinuation symptoms is very, very uncommon with valproate. So let's not forget, as we prescribe our drugs, there are also drug-drug interactions that we must worry about. Now, don't forget, we are now advanced providers. We're the one prescribing this drug. So we have to be cautious with the drug-drug interaction that we may encounter. So lamotrigine dose should be reduced by 50% if we are using it with valproate. Because valproate will inhibit the metabolism of lamotrigine. Don't forget, an inhibitor drug will raise up the level of the opposite drug. Therefore, it's going to raise lamotrigine level to a dangerous level, and it can be a risk for Stevens-Johnson's rash. Another drug-drug interaction, plasma levels for valproate may be lowered by carbamazepine. Don't forget, carbamazepine is what? Is an inducer. Phenytoin is an inducer. Phenobarbital is an inducer. Rifampin is an inducer. They can all lower valproate. So as we are prescribing valproate, reconcile your patient's medication. Check, do they have all these drugs already? Are they taking these meds? That is part of your assessment as an advanced provider. So aspirin may inhibit the metabolism of valproate and increase valproate plasma levels. Plasma levels of valproate may also be increased by what? Felbamate, clopramazine, fluoxetine, fluvoxamine, topiramate, cimetidine, erythromycin, and ibuprofen. Because why? Those are all inhibitors. So now valproate can inhibit the metabolism of what? Phenobarb, phenytoin, and can thus increase their plasma levels. So we need to be mindful of the labs we're going to draw, the drug-drug interaction, and so on and so forth. If you feel like you need this kind of content, it is a different pharmacology when we review for boards. It is now a different level when we are now trying to now bring it to real life, like prescribe to our real patients, right? So we have to know almost everything, not just what is going to be on the boards anymore. If you want to dive into pharmacology with me, you want to know a lot more than you knew for your board exam. You want us to take you to your clinical with this, full preparation. You need to sign up for a CER review, CER. That is Certified Expert Review. How do you sign up? You want to go to www.npcertificationacademy.com. Speaking here is Dr. Kehinde Elisha, founder of NP Certification Academy, founder of Kehinde Elisha's Learning Institute, Kelly, founder of Mental Health Podcast. And thank you today. Have a wonderful day. Bye-bye.